Hi, I'm Josh Elston, and today we're talking about awake surgery. So, when people talk about anesthesia for plastic surgery, they're usually thinking of general anesthesia or going to sleep, having a breathing tube, which is a very common way to do surgery, but it's not the only way. So, you think about if you go to the dentist, they usually give you local anesthesia, which is just a numbing medicine, plus or minus maybe some type of inhaled gas that kind of helps you relax and not really understand what's going on. All of those options are still possible for plastic surgery procedures as well. It just matters that you thoughtfully go about it with the correct anesthesia for the correct patient. So general anesthesia would be the highest level of anesthetic when you have no reflexes, you're paralyzed, you have a breathing tube, and an anesthesiologist is monitoring your breathing, heart rate, blood pressure. If you go down to IV sedation, that's slightly less, where you may or may not be maintaining your own airway, but you're getting something through an IV that helps to sedate you and make you fall asleep. The most awake procedure would be something under local anesthetic, which is just numbing medicine, like you would get it for your teeth if you were doing a dental procedure, or if you were having a small skin procedure where they inject you with medicine under your skin. People want to know, can you be awake for your plastic surgery procedure? The answer is absolutely yes, but the answer is also maybe. You have to be the right type of patient, it's got to be the right type of procedure. Basically, we're trying to make sure that it will be safe to do the procedure and that you're also going to do well with it. If you have a lot of anxiety, if you're afraid of needles, it's probably not going to be a great time for you, and that won't be a good choice of a procedure for you. You might be a better candidate to go to sleep, have a breathing tube, and be monitored in that way. But if you're not a high anxiety person and you're open to the idea, it's definitely something worth talking about because the recovery can be faster and the cost can be significantly less. I think when we're talking about awake plastic surgery, you really want to look at what the benefits and the risks are. Specifically, the benefits would be that you have a quicker recovery time. You don't have to go to sleep with a breathing tube and you don't have all of the inhaled anesthetic gases and the drugs that tend to make people feel groggy or nauseous after surgery. So when you finish your procedure, the way that you feel then is usually the way that you feel for the upcoming few hours. Most people are able to walk themselves out of the clinic afterwards because they haven't had any heavy sedation. And a lot of people find that as a massive benefit. The other benefits are that the cost is significantly less. If you don't have to have an anesthesiologist monitoring you, if you don't have to have more medications, those things can kind of cut into the cost a little bit and make procedures significantly more affordable for someone. I think the benefit that's very under-realized is that you get a little bit more agency over your situation. You know who's going to be doing your surgery because you're awake and you're there for the whole thing. You have the ability to verify what your surgeon is doing and also make sure that you're happy with the results. We can pass you a mirror. You can look at the sides and make sure that they compare and they look symmetrical. If there's something that you're concerned about in terms of what's going to happen, you're worried about waking up. Well, that's not an issue with this because you never go to sleep in the first place. So I think there's some inherent risks and cons to doing surgery awake. One of them is if you're just the type of person that's very nervous, very anxious. If you come in thinking that it's not going to go well, then it's probably not going to go well. Once you get into this spiral of anxiety, the whole thing really kind of gets out of your control and you're never going to be comfortable. So identifying someone like that preoperatively is really on me to make sure that it's going to be a good fit. Another con about awake surgery is that it takes longer. You're awake, you have to be comfortable, so we have to get you numbed up, we have to make sure that everything's going smoothly, and we can't proceed until you're fully numb because you're awake. So if you were asleep, then we can proceed much more quickly and the surgical time is often less. When you're doing something awake, you can often do less aggressive procedures. So some things that aren't really achievable, at least in my hands, when I'm doing an awake procedure would be like a tummy tuck or a full mommy makeover where you're doing a tummy tuck and a breast lift. Those things would end up taking me about 5 hours if we were doing it asleep. So if we're doing it awake, it's really excessively long operative times, and that's really not safe for someone, and it's not comfortable. And after a couple hours, most people are kind of over it, and they want to go home and just recover. They're sick of having someone hanging over top of them and asking them if they're okay every 30 minutes or so. So the biggest limitation is that you can't be quite as aggressive. So 99% of what I do is awake surgery, and specifically we're talking about awake liposuction, awake breast augmentation, awake mini tummy tucks, and awake breast lifts. So that's the real bulk of my practice, and I think that awake surgery lends itself well to those types of procedures. So regarding awake liposuction, that's probably what I do the most of, and that involves getting the fat numb and removing that. Once you have the fat out of the body, what you do with it is kind of up to the patient. Do you throw it away, or do you want to use it for some type of natural breast augmentation or some type of natural buttock augmentation? Those things are both possible using your own fat, and it's permanent, and it can be a really nice way to provide an augmentation to someone when they were otherwise going to have a procedure and throw the fat away. Regarding awake breast lifts, it's very nice to do that with the patient awake, because then they can verify that they agree that the breast looks symmetrical. Most patients do have some preoperative asymmetry between the breasts, and you may need to do little maneuvers to get that corrected. And having the patient with the ability to sit up during the surgery, verify with a mirror that they agree that everything looks good. It's kind of like an insurance policy for me to make sure that what I'm doing not just looks good to me, but it also looks good to the patient, because I don't have to live with the breasts every day and they do. So I want to make sure that they're happy with their result as well. I think there's a lot of misconceptions about awake surgery. I think previously, awake surgery kind of was like the fly-by-night sort of snake oil salesman surgeon, and that's just not the case. I mean, if you think about when you go to the dentist, they're frequently doing awake surgery on you, removing teeth from your bones. So, if you can do that and have someone completely comfortable with good nerve blocks, you can do the same thing with plastic surgery procedures. I think typically most surgeries were done under general anesthesia, and then there's a certain inertia that comes along with that. Once you've kind of done something for a while, it's hard to change how you do things. But as technology, as medicine, and as technique get better, I think it becomes much more possible to do things with people under less anesthetic and give them a little bit more agency over their decision-making process for their surgery. So I think one of the misconceptions is that if you are having awake surgery, you will feel some degree of pain, and that's just not true. I think what most people experience is a degree of anxiety, and that can be treated with medications very, very easily. Most people don't have pain. They will have maybe sensation of pulls or tugs, because when you're numb, you may not feel pain or sharp burning pain, but what you might feel are sensations like someone is moving you or someone is pulling or tugging on areas of the skin. That's not necessarily painful, but it can be a little bit disconcerting for some people. Again, that's usually very, very easily treated with anxiety medication, things like inhaled gases to help relieve anxiety temporarily. And then once someone is numb and they know what's going on and you're taking their time, it's not a painful procedure and they go through it very smoothly. Part of the mission of my office and practice is to normalize and safely perform awake plastic surgery procedures, because I think that's where things are moving towards. But that's not the only avenue that I can use to do surgical procedures. I'm a board certified plastic surgeon, so I still have hospital privileges. I can go to an ambulatory surgery center and have a board certified anesthesiologist put you to sleep. I just choose not to for most of my cases because I don't have to do that. It saves the patient on cost, it saves them recovery time. It makes it easier for scheduling because I don't have to ask someone for permission. I use my own space to do it. I think it's a really important distinction to make that because I'm a board certified plastic surgeon, I have the ability to go to these different places. A lot of people that do awake surgery aren't board certified plastic surgeons, and they are not able to take you to a hospital or to a surgery center because that is outside the scope of their practice. Some people will take a weekend course and they'll learn how to do liposuction, or they'll watch some videos on YouTube to think that they know how to do a facelift or a breast lift, and they will do surgery on you in their office awake. That doesn't mean that they're qualified to do that. So as part of my training in plastic surgery, 6 years right out of medical school, I learned how to do all these procedures, and I've been sort of certified by my board to perform those. So that gives me the ability to do these procedures wherever I want, wherever it's safe to do them, and it's going to help to keep my patients safe. And I think that the misconception that this is not safe to do it or it's going to be painful comes from a long history of people that really shouldn't be doing these procedures, performing them in areas where they shouldn't be doing them. I would say if you've ever considered having surgery, it's at least worth a discussion to find out if you'd be a candidate to do it awake. If you're the type of person that's afraid of needles, it's probably never going to be a good option for you, but I think that there's a bell curve of people. Some of them are absolutely against it, some of them are absolutely for it, and then there's a lot of people in the middle that could probably go either way. I think part of it is just making sure that you've got an empathetic surgeon that kind of understands your needs and is willing to go through it with you slowly and take their time. And if you've got that and you can handle someone's anxiety and move through things slowly instead of trying to push, then you can do this very comfortably, and it can be a really good option in terms of your recovery as well as your comfort level during the procedure.